So great. Welcome to our spotlight session. This is an exciting one because it kicks off an entire series that we want to use to explore the state of diversity, equity, and inclusiveness work, not just in the United States, but around the world, through different lenses, experiences of DE&I practitioners. And I couldn't be happier to start off this little series for us today, because I'm talking to my good friend and colleague Lisa Gutierrez, who has had a phenomenal experience in the area of leading DE&I with organizations such as Indiana University Health, Cardinal Health, Cummings, Procter & Gamble, Deloitte, and a few other organizations along the way. And one thing that fascinates me, not only about how Lisa works, but the person that she is. In fact, there is no distinction. I think Lisa is at work and works the way she is and the way she sees it. And I have to tell you, Lisa, I always admire your unique way of doing this work. And I think when we are talking about this work, right, we are obviously talking about leading, implementing, or what I call sometimes doing DE&I in organizational contexts. And you've obviously worked across many. The last one you had this function in or did this in is obviously a big healthcare system. And so that kind of prompts me to maybe use as an opening for our spotlight session today the simple question: is doing DE&I different in a healthcare system than other organizations?
Well, first of all, thank you for inviting me into this. As you know, I love learning, and being able to be part of these kinds of interactive learning sessions just brings me joy. Yes, it is extremely different, and I didn't expect it to be that different. So full disclosure, I had resisted getting in healthcare, and I call B2C, business to consumer healthcare. So Cardinal Health was really more about supply chain healthcare. So to be in that business to consumer, I had family members that had worked in big health systems like Kaiser Permanente and others, and everybody would always talk about how hard it was, and I had resisted it. So when I actually got into or took the job with IU Health, I did it. My why was a friend of mine had just been diagnosed with cancer. And Martha told me, she said, I know I'm getting the best clinical care. It was in a different state, but she said, there's something missing. And some of that missing was that compassion or that kind of kindness. She said, she made this comment to me. She said, this is my first cancer journey. And I know the place I'm going, it's maybe their 10,000th cancer patient. She said, but I don't feel like I'm getting it. So her comment to me was, what would happen if you applied your DE&I superpowers in healthcare? And I was like, So I did it. It was probably, I'll say this, it has been the most purposeful, purpose-driven experience I've had. And it was also the toughest. And the hardest was a lot of the research and a lot of the logic that we have for doing DEI as practitioners relies on certain things. Like it relies on, for example, if you're going to do diversity training, you're assuming you have time to do it, and that your actual internal customers can carve out the time. And what do you do when your actual internal customers are also the physicians and the nurses and the environmental service workers that are delivering service to patients? And we're the they, right? We're the patients too. So we're thinking, I don't want you spending time with training. I want you
I want you to
to
help me.
focus on me.
Yeah.
Focus on me, right?
Yeah.
So I found that it was also an academic health system. I found that there were a lot of people that wanted to learn, had some sort of interest in DEI, but it was the context that I had to adjust to. And so I think you and I have talked in the past. One of the ways that I do my DEI work is to figure out the rhythm of the business or the rhythm of the organization, and then start figuring out how do you intersect or integrate DEI into that rhythm. The rhythm of that was I had to, for example, the diversity trainings that I did and built out a curriculum, it couldn't be more than an hour and a half. And then the micro learnings after that had to be like 5 minutes, 5 to 10 minutes, where they could keep, remembering and practicing, but they would have to do it in between, in between their clinical care. So I found that really hard. The second one that I found really hard was really understanding, growing up in my career, starting with Procter and Gamble and these organizations I've worked with, Deloitte, they've always had great mission, vision, values. IU Health had the same. The hardest was if somebody wasn't behaving with those values. In corporate organizations, you had processes, for example, to fire people, right? In some cases, to even fire your vendors. If your vendors were racist or something like that, it's much more difficult to do that when, for example, you can't fire patients. You can, but it's very difficult. And you have to look at clinical care, but there's medical laws and policies for how you can actually recalibrate a patient. So we had patients, for example, that would use the N word in the year 2020, 2021. They've been using it for 41 years. I had this one nurse for 41 years that she's been delivering great care while these regular patients and families are calling her the N word. Now, in a normal company, you'd be saying, no, you don't get to do that. But in a healthcare system, especially when, part of it is your commitment to delivering care to people that, not only are your paying customers, but also the people that you're delivering community benefit to or whatever. They have these parameters where they can say things. So what I had to figure out too was, how do you help teach people to, in a customer service way, still deliver great care, but also as employees being able to say, I deserve respect, but then, still be able to do all that within, 20 minutes or less. And that was probably one of the most challenging, because I had to think about, what do I know and what can I do, but what will be received and integrated into people's muscle memory in a way that will help the end game, which was getting people healthier, right, in the state. And my brain was hurting a lot. It was hurting a lot
Oh,
for those past 4 years.
yeah, just that dilemma alone, how do you then address patients, right? So, I mean, like you
Right.
said, you can't just fire patients. You have an ethical responsibility towards patients as well. But if patients' conduct is clearly discriminatory, racist, derogatory, wow. I mean, it leads me also to the question of, you need to fortify employees, right? Equip them with
Yes.
resiliency to withstand some of this, and they are stressed and don't have any time.
Yep. So, in the DEI practitioner space, we've always had like 4 or 5 buckets of work, right? There's always been a bucket of work called the employee experience or belonging. There's an employee thing. There's always been a customer thing.
Right.
There's always been a community thing, and there's always been a supplier diversity thing, right? So you start thinking about that. What ended up happening for me was really rethinking some of that. And there was that, your community is also in a healthcare system. Your community in many cases is also your customer.
Right.
And then their families are the customer, right? And you start thinking about, what does it mean? And then how people get paid, which is, a lot of times you're relying on government funding, Medicare, Medicaid, that kind of thing. And what they say, you can pay for or not. It lends itself to a very complicated system. So the thing that I focused on in where I had been in my career was, a lot of my organizations were further along their DE&I journey, maybe not in major areas, but they were further along. So they were focusing a lot. They had figured out a lot on the employee component, right?
Mm-hmm.
Some employee equity. I mean, you obviously were going deeper into employee belonging, connection, retention. But a lot of people were starting to say the next thing is, just like you start out with employee resource groups, then they were going to business resource groups. People were starting to think about that customer component, right? When I went into IU Health, what I observed, I took about, the first 120 days, I was talking to people, and I realized that if you look at those buckets of work, the bucket of work that was clearly a major deficit was giving, I called it this, giving love. Oh, I love that. Giving love to the employees. And so one of the things they asked me, they said, what are you going to focus on? And I said, I can see that we're delivering great care to patients, maybe not perfect care, but great care. But I said, we're skipping over the employees. And it reminded me of back in the day, Nordstrom. Remember the Nordstrom experience?
Yeah.
Where Nordstrom said, if we focus on employees and giving them, giving really, helping to develop employees, giving them the freedom, right, to even take exchanges and deal with that,
Right.
then we're going to have a great customer experience. And it was radical at the time, remember, because it was radical about, they were like, we're going to worry about, of course we'll worry about the customer, but we're going to focus on employees. And I went back to some of those models and started saying, okay, how do we give love to the nurses? What does love look like for them? What does love look like for the environmental service workers that were going into the same family situations that the nurses and the physicians were? What does it look like for the nutrition and diet? What does it look like? And you end up at a place, and that's why I thought it was interesting, one of your other spotlights on compassionate curiosity. You end up at a place where you start thinking about, what does compassion mean to them?
Yes.
Not what do I think it should be. It's what does it mean to them? And I think that resonated really well, because I remember some of the nurses, they were just like, what are you going to do? Are you going to? And I said, I don't know what I'm going to do yet. I said, but I'm observing this. And I think that we've got to figure out how to shine the light and give you some love. That's a very non-corporate answer.
Non-corporate answer. And I was just wanting to ask you, I mean, I think so much of this work is actually about love.
Yeah.
But we don't use that language, right? We corporatize the language: diversity, equity, inclusiveness, belonging. We go maybe as far as belonging, right?
Right.
But
It's
the
love.
core is not belonging, right?
Right. It's fascinating. So I started, one of the freedoms of working in a health system was it gave me the freedom to use that word. I was like, because people talk about well-being, but I'll give you an example of love. I remember at the height of the pandemic, we were thinking, and I was thinking about that, what does love look like? And we put in a program, and this came from our talent management folks and others, but we were talking about this. It was a program to allow the caregivers to sleep, because they were afraid of driving home tired. They were afraid of going home and also infecting their family. So we created a hoteling system with free hotels or free sleep. They used the sleep labs in some cases that nobody was going in as patients.
Of course.
And they said, go sleep, go sleep. And it was, when you think about that, and so people came out refreshed, they felt cared for, because when they went home to their family, they were more refreshed, they were showered. Sure. It was those kinds of things. So I think, when I step back to your point, I think it's, what does love look like? I've traveled to 31 countries, and I always have that thought in my head going, what does love look like here? What does love look like? And sometimes it's like, go have a meal. Yeah. It's eating the food that they serve you, right? It's going to I've been to 4 different funerals this summer in different kinds of churches and faiths. And I call my friends. I'm like, okay, educate me. What am I supposed to wear? I want to show respect. They're like, you better wear the black dress. And this one, don't wear
wear black.
Don't wear the black. But they laughed because they said, thank you for asking. And then I said, okay, then where do you want me to sit? What do you want me to do? And each time, like, I'll tell you this one, in one of the funerals, it was so funny. It was amazing. I go, I'm going to do that in mine. Before anything started in the funeral, the pastor had everybody stand up and give a standing ovation to the person that had passed away. And they said, this is a standing ovation for Mama Sadie for a life well lived. And everybody stood up and gave a standing ovation. And I thought, wow. I grew up Catholic. I want a standing ovation. So I'm like, I'm going to build that in. I would never have known that had I not gone to a different, a funeral. And people always say, well, why would you go to a funeral? And I'm like, because that's also how people show what's important to them.
Well, you just illustrated the power of diversity and why we do this work, right? Because we know that we are all, I'm going to sound like an anthropologist now, but,
I love it.
No surprise.
Do it.
We are all bounded in our experience, right? We only have one out of a gazillion experiences, and we are only part of one out of a multitude of cultures. So our culture has figured out certain things and does things in certain ways, and other cultures have done it differently. And here we are collecting a little bit, right? We're collecting from different cultures, and all of a sudden you say, I want a standing ovation,
I know.
And why
Because
is this
sometimes
not
other
part of
cultures,
my tradition, right?
and they've done it better.
Yeah,
They've done it better, right? And so you're like, oh, anyway. So I think that's what I noticed in healthcare, right? There were just some amazing things, and there were some major gaps in terms of love. So trying to figure that out.
so that probably leads me to another question, which is why we exist. I mean, why the Inclusive Leadership Institute exists, which is the focus is obviously we do a lot in the space of DE&I, but we focus on the what I always call the art and science of leadership in it, right? Under
Yep.
the umbrella of inclusive leadership. And specifically because I've learned, over the years that nothing really happens in an organization, in an institution, unless the leaders, the top leaders, not even the top leaders, sometimes the leaders on the ground, whoever is looked at by others for leadership as a model, actually start to expect, reinforce, and reward what it is that we're talking about. In this case, inclusiveness or equity or love, actually. But how do you see this when you bring this language or this philosophy to leaders in the organization? How do they respond? Because I found, well, maybe I'll wait for your answer.
Okay.
I just find the language of love difficult when it comes to leaders, especially in corporate settings.
Yeah, it definitely is. I think you helped me identify this, that I do it in an anthropological way, but I believe I use the language of the organization, whatever the language of
Mm-hmm.
the organization is, right? I call it the rhythm, but an example at Cummins, their language of that organization was a Six Sigma language.
Mm-hmm.
If I'd come in and started talking about love to engineers, from around the world, but they had a Six Sigma language and a philosophy and a methodology, and they had developed and trained people all around in 50, 60 countries. And that methodology is about reducing variation, right? So I studied it, but I thought, okay, if that's about reducing variation and you're hired to come in and increase variation, right? Increase variation
Right.
of backgrounds, increase variation of experiences, whatever. Immediately I had a bunch of people going, oh, what are you trying to, I just learned it this way and you're trying to tell me to do something different. So I started calling it, in the DEI practitioner land, I think we have three primary audiences of our work. I think of it like, kind of a spectrum, but on the left side, we've got people that are hostages to the information. They're like, you're not going to make me change. How dare you try and, that's not diverse when you're
Right.
making me think something else. At the far right, you have zealots. You have people going, good, finally, and I'm going to have you do what I've wanted you to do for the past 30
Right.
years.
I've
So I've got
been
the
waiting
zealots.
here, and
I've been
finally.
waiting. Yes.
Yes.
Yes. I call it the yes. And then you've got the ones in the middle that are kind of neutral. And they're just kind of sitting there going, I just want to do my job. I don't really understand it. What I do, depending on the language of the organization. So Cardinal Health's language, for example, it looked like a supply chain language at the beginning, but it was an acquisition language. They'd acquired 40 companies in 4 years. So I had to shift, I focused a lot more on inclusivity, and, including people and connecting them rather than just looking at differences, because they had been focused so much on we're so different because we're outsiders, the insider outsider language. But what I noticed is that part of it as practitioners is we have to shift. So as a younger practitioner, I was looking at people as if they didn't get it. They didn't get D&I. And what I started realizing was on that spectrum, they maybe got it in different ways. So I changed my approach, and my approach was I'm going to assume that you're great at something. Like you're great at something. What's your
Right.
superpower, right? What's your
Sure.
superpower? And I started asking that language. I go, okay, I know you're great at something. And I'd say it like that. And I go, I want to know what you're great at. And then people would start saying, well, I'm great at this. I'm great at that. And I'd be like, well, where's that coming from? And then they'd start telling you your background. So there was one leader I was talking to, and he was more on the, what are you going to tell me? I've been a leader here. And then I said, what's your, tell me about where you fit on tell me about your story. Tell me some of your story. And he said he grew up on a farm. I grew up on a farm too. And I said, what's your superpower? Like what part of that farm experience do you find yourself relying on now as a leader? And he goes, Lisa, I like to get in really early in the morning and I like to get stuff done in the morning. I like to, it's always done, and I said, cool, that's amazing. I go, I'm not a morning person and I grew up on a farm too. So I'm like, I'm the opposite. But I said, let me ask you a question. I go, is there anybody on your team that you find yourself, that they're not doing that and you find yourself going, why aren't they here this morning? And he got really quiet and he said, yes. And I said, okay, now visualize them and just don't tell me who they are, but tell me like what you notice about them. He goes, they're all parents. They were all like, dropping off their kids. They were always coming in a little bit late. They always wanted to start a little bit later. And I said, so could your superpower actually be a barrier, to some people? So I found that here's what happens is I think when you approach everyone with that assumption that they are awesome and they're awesome at something, people start coming towards that neutral.
Yeah.
And they start coming towards a neutral and then they start wondering. Then the second thing that you said, and I believe this too, I tell everybody, my phrase is great leadership trumps DE&I every time. I've met great leaders that care, that behave, and that just are. They're just are. That employees love them from all levels. Women, people of different genders, non-binary, LGBTQ, men. They just love them, and I've met them, and many of them have never done a diversity training. Don't understand the language of it. They just are great leaders. So what I try and do is find those people, and I find them, and many of them are, like you said, they might be an environmental service worker. There was this one leader with our environmental service people that she adapted all the shifts to the individual. So this one wanted to start at 8. This one wanted to start at 10. She was shifting. She had zero turnover.
Sure.
She
Of
had
course.
everybody, and she got all the work done because she told everybody, she goes, we still have these patients and clients. She got all the work done. She had the highest engagement scores. She was adapting. We showcased her.
Yeah.
We showcased her inclusive leadership because she was adapting. She was doing situational leadership. So I think it's bringing people to that neutral. It's focusing on what people are amazing at, because almost everybody will tell you what they love about themselves when they say I'm good at this or they want to be good at. They tell you what's special about themselves, and then I try and figure out how do you highlight that or put the shine on it, or how do you let that thing, that superpower, help you with your goals, your business goals.
And I tell you also what you're doing when you do that. You are not only assuming that, that everybody has a strength. It may not be DE&I, or
Right.
or knowledge about DE&I, but they may actually be rather good at it without knowing it, right? It also, you're starting a relationship with appreciation and
Yes.
and almost feeling out where do people feel pride, right?
Yeah.
What are they proud of? And when you build a relationship that you need, obviously, to succeed, um, based on that appreciation and based on recognizing what they're proud of, then you're already at a very different starting point than we are when you're entering this relationship with the assumption that, they're not getting it. It's going to be
Yep.
hard. They're not going to get it. They're not on board with me. All of these are untested assumptions frequently. And this leads me to my next question. And this is really about, three things that, that you laid out. One is the language, first of all, the attitude that I sense in some DE&I practitioners. And I have to say some,
Yep.
they don't get it. I am somehow the holder of a secret, something better that others don't get, and therefore others are lesser than. This subtle
Yep.
attitude of superiority that sometimes stands, and it's maybe not even conscious. We talk
Mm-hmm.
about unconscious biases. That might be an unconscious bias sometimes in the DE&I world, and that creates distance, right, to quote unquote our internal customers, in a sense. And together with that, this is again my observation, that I feel that the field of DE&I makes language very complicated. The vocabulary of DE&I is not, it might be appropriate. It might actually be rather exact, right? And coming from all kinds of academic research and so forth. But it's a different language. And we are trying to make our customers, internal customers or external customers, to speak a language that is not germane to them. And then we come perhaps with an attitude that, see, they don't get it, and
Yes.
and I wonder sometimes if that's not the biggest derailer in in this work, actually.
I think you're hitting on something. So at the height of 2020, I've always focused on racial justice. So I always
Mhm.
design it in, right, as a thing. So I was doing it way earlier, but there were a lot of people that became chief diversity officers at the height of 2020, and I was coaching some of them, right? And they would call me and they'd say, "Okay, now I don't know what to do here. I don't know what to do there." And I think so. If you take an expertise like IT, right? They have their own jargon, they have their own language. When I go to an IT person, I always tell them, I said, dumb it down for me. Like,
Yeah.
dumb everything down for me, because you're talking in language and I don't understand what you're talking about. And they always look at me and they go, "Why don't you understand?" I go, "I'm going to start talking HR stuff to you right now." And then they look at me and they go, "Don't do that.
Don't
Don't
do
do that." I said,
that.
it's the same thing. It's like you're talking French, I'm talking Spanish, and we just don't click, right? So language is important. When I was at Cummins, we had to refresh the diversity business case at the time, and we were globalizing. And for me, it was a big aha, because a lot of the language that we were using in the DEI space, it didn't translate. It didn't translate into 16, 17,
Yeah.
18 languages. So we had a global group of people, of leaders, and I said, forget, here's the intention. Forget the diversity language. Put in the words that will work in Brazil, that will work in India, that will work in China, that will work here, 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 and put it in. Let's be clear enough and put it in metaphors that work, that will work, right? And that was an aha for me, which was, I had to fight my own. Well, this is what the industry says we should say, and this is what the research is, and just sit there. And I think that's also about how you simplify things. Now that comes with experience. So I think what I've noticed in the DEI industry is we have a lot of people that have gotten into roles without a lot of experience. If I had been a CDIO with my early practitioner experience,
Hmm.
I would have felt the pressure of knowing things. As a practitioner now, after I think I have over 20,000 hours of doing it now, I have the confidence of being vulnerable to say, I don't know your business. So teach me, but let me go research. What does it mean to do diversity with ortho surgery when 94% of ortho surgeons in the world are men? So I came back and I told the leader there, I go, we got 6% we've got to play with, right? But we can start developing more than the 6%, but it's going to take you another 7 years before we get to that end game. So what does it mean? But I now, when people say things to me, they go, well, Lisa, how would you rate yourself on a scale of 1 to 10 as a D&I leader? I said, on a good day, I give myself a 70%, man, on a good day. Because right about
Yeah.
the time you think you understand it, right, you go to a different country and everything you understand to be true in one country is opposite there. And you're sitting there going, okay, now what do I do? And I think that's what I've noticed in the industry right now is we've got a lot of practitioners that maybe don't have as much depth, and then they're expected to be experts in everything,
Yeah.
and you're not. And then you don't know how to say, I don't know. Because you're excited about being in the role, right? You're excited about the work. And so I think the practitioner, when I started doing this work, you couldn't get a PhD in it, right? Now you can. But I think you also have to practice it. So I really think about Malcolm Gladwell's book of Outliers, right? How are you doing it? And are you doing it in different ways? Are you trying it here? To elevate women in India, when I was working on that strategy, I also had to build in and understand the legal caste system. You can't, and everybody's like, well, we don't have that in America. Well, we do in India. So here's how we got to build that in and think about it and work with it or around
Absolutely.
it, right? You just and you're sitting there going, it shouldn't be that way, but it is. So what do you do about it? And that ability. So I end up using more of I use more of the stuff I learned in sales, which is to adapt to where the customer is,
Yeah.
than actually traditional D&I or HR stuff.
Which is probably, I mean, a really good practice. And I want to come back to the global variation because
Yep.
I think when we're exploring, especially in the Spotlight series, when we're exploring what DE&I means, I mean, we're going to take a little tour around the world, actually, into different areas. And in the DE&I space, the United States has been such a powerful, as in other areas, has been such a powerful center of where this work to some degree started, where it was shaped, where
Yep.
categories were invented to some degree, right? Or and then exported, as has happened so often. And you know, across the globe, you know, we build culture around diversities. You know, I've started to actually use the plural of the word diversity, because I
I
think
like that.
diversity exists in again, like a boundedness, you know, in a space, in a geography, and it's with whatever happens in that space where that actually manifests, that is shaped by historical forces, cultural forces, influences. It's very dynamic, but it's one diversity, and then there are other diversities, right? And and I don't know if this will catch on. I'm not sure. We talked about
I
language,
use
right?
differences, but you can
But
use diversity.
I
You're
actually
funny.
think it would be more precise to really examine what diversities am I speaking to? Do I need to consider here? And also, which diversities am I familiar with and which ones am I not? You know, to your point about India, that might be the caste system and other aspects of diversity in India may be entirely unfamiliar to us, right? And what so often the D&I conversation starts with a US lens. At least that's my observation. Not that there is anything, you know, particularly problematic with it, but it creates a gap in resonance sometimes. And I've seen this early. I mean, I've done work at IBM, for example, of globalizing
Yep.
their DE&I work, you know, and it was very, and this was at the you know, late 90s, I would say. That's where I got my gray hairs, you know. but
I've only
but
met you with gray hair, so that's all
but
I
I,
know.
you know, I was at the time in Colombia, South America. We were in Japan. We were in Germany. We were in so many places around the world where IBM obviously had offices and so forth. And it was very clear that the language of diversity that was reflected, was
Very.
invented and reflected a lot of the US diversity, even the case studies we were using, even, you know,
Yep.
just did not resonate locally. And it created a lot of resistance. However, the phenomenon we are talking about, the phenomenon of differences in some sort of a social context and perceptions and biases and so forth, the phenomenon itself, if we strip it down, is universal. But the manifestations of it, and I feel sometimes we confuse manifestation with the actual phenomenon in this work, and then like a, you know, and then we don't account, we don't have the humility and modesty that you articulated of simply operating with. There's a lot about this field that I don't yet understand. I'm just curious. What I mean, how you know what?
Yeah, I love it. I'll tell you one thing. When I coach D&I leaders, you know, that are new to it, I tell them, I said, there's one thing you have to figure out very quickly and very early on is you have to figure out where you stand,
Mm,
you know, on DEI. And they go, what do you mean? And I said, you have to like differences. Okay, you have to be willing. So I always find it very oxymoronic and ironic when people are doing DEI work and they only want to focus on, nope, it's this way, but not, you know. And I'm just
with
like,
this diversity that, you
yeah,
know,
this one, but not that, you know. And I'm
yeah.
sitting here going. So I always tell people the definition for myself as a good leader is: am I as great a leader to the people that irritate me as I am to the people I
Oh,
like?
that's such a great question.
Right? Because I think that was in my leadership journey. It was also thinking about, you know, do I, you know, that assumption that a lot of times you only want to be a leader for the people that are like you, right? Well, I had to learn, okay, I had to adapt to, I had an extreme introvert And I'm an introvert, but I like to, process like this and talk. And he didn't like to do that. And so I finally said, I need to do a little bit of that for me.
Hmm.
And I said, what would you need? And he goes, I need notice. So I'd be like, okay, we're going to talk about it on Thursday. So I'd tell him on Monday so he could think through it, process it, do it there. And then we would have fun on Thursday, right? I had to shift. When I wanted to call him on a Thursday and just say, let's just talk about it right now, he was
Yeah.
frozen, right? That is a difference that, growing up in my family, my dad was always, talk now, so there wasn't a lot of, that one gets to be an introvert. It was more like, you're too quiet. Why aren't you saying something? So I think that that's a belief. So part of what I've been doing is thinking about what do I believe to be true, or what do I know to be true? And I believe more things than I know. So a lot of times I'm sitting there going, I don't know that. I believe there should be equity. But here's a great example. When I was doing a lot of diversity work globally, I would have people in the UK and others say, that's a very American thing. And then I would research, and then in the UK, they had an equity council, right? That was in
Yes.
2006. And I said, you kind of have this thing. And they go, no, we don't. And I said, your actual parliament has it. Here are the same requirements. It was the funniest thing. But I started using that language, which was equity language,
Yes.
right? Not diversity, not equality. It was equity language. I was in Australia, and they're going, well, that's an American thing. And I said, you have some Aboriginal descendants, and you actually have some requirements that require you to do this. And their tribal affiliations are very similar, or they operate very much like the sovereign nations I've worked with in the US. So I went and met with one of those workforce centers, and they said, we want these jobs. And I go, we have these jobs.
Right.
And that happened in a half a day.
Yeah.
But I think a lot of it was because I was thinking, okay, well, I do, you keep saying it's so different. So there are some similarities, but there are, to your point, this assumption of dismissing, like, I'm going to dismiss that difference because it's not what I know.
Exactly.
And that's the part that I think I've been growing a lot and shifting, is going, I don't need to know, but let me understand what you believe and what you understand there. And then how do we do it? So when I was in India, for example, at the time, LGBTQ was illegal,
Hmm.
but we had a belief that we wanted people to bring their whole selves to work. So I was sitting there going, okay, those two things, got it. But what are to your point, the manifestations of that? It was danger. Somebody could be themselves in the workplace and then go home and be killed.
Right.
So we ended up building in the processes to say, how do we make sure they're safe after they leave the space, and then they're safe when they get back? And then as we were doing that, we found out that women were feeling unsafe. And then we found out that there were men feeling unsafe in certain parts of where we were sending them to go work. And all of a sudden you're like, okay, now the overarching strategy is going to be safety for everyone. And we're going to mix up the recipe here for this. We're going to mix up the recipe for that. But at the end of the day, 5,000 people should feel safer
Yeah.
working for us in there. It was powerful, right? But I didn't go in. I think that's a part, is like, I didn't say, I know it's this. I was just like, okay, given that, given that, how do we still do it?
But I love that because you stay engaged with that gap, right?
Yeah, that's a good way.
You're engaging in the gap with what I believe to be true and what do I actually know, what is true, and you stay open to be surprised. And I love that, actually, because I think that's how this works. If there is a should be done or could be done, or at least where it could benefit from, because I think what you also spelled out is a recipe for avoiding resistance, or
Yeah.
at least engaging with resistance as well. And I wanted to go there because there's a question actually
Okay.
that came in around this, how do we apply this with particularly reluctant or resistant leaders? Because I mean, I just want to comment on what you said about, oh, this is such an American thing that you're bringing in, right? I mean, I've seen this globally as well. I was part of it at some point where I said, oh,
Yep.
this is a very American thought. But at the same time, I have to realize this is part of my resistance, right? What we do when we don't like an idea, we other it, right?
Yep.
This does not belong here, right? So we put a label on it, and whether it's American or not, or whatever the label is, it's just foreign, it's strange, it doesn't belong here. That's what we do when we do that, right? Say more about how you work with resistance. Is there more to working with resistance than that recipe that you just spelled out?
Okay. Yes. The methodology I use the most, I think in this work, it's about influencing, but it's also getting to an end result. So the methodology that I found myself relying on more than anything else is called decision mapping. So it's looking at key decisions that you're making in an organization. And the methodology looks at involved voices or viewpoints, right? So you have owners of decisions. They aren't always aligned. So an example was one of the things I was working on at IU Health was patient civility, but it had 27 different decision makers because they were in different avenues, right? You had risk management, you had this. So you have expertise, but you have decision owners of a decision, but there wasn't one central owner of a decision. You have influencers or evaluators. So they're evaluating whether it's, the data, but they're also evaluating how it's going to be rolled out,
Mm-hmm.
change leadership, those kinds of things. And then you have implementers of decisions. And in some cases, it might be one person that's also the owner of a decision, that's also an evaluator, and is also an implementer of a decision. So I found myself using that, and I tend to do it automatically in my brain, and also kind of looking at people going, okay, based on their day job. So the other thing is looking at people's day jobs. Most people have a passion or are doing something that they are being paid to do, that they want to do. So I love this organizational diversity, and they have goals.
Mm-hmm.
So you have to understand what does success look like for them. And so I try and figure out within that, okay, are we all working on the same decision? So I'll give you an example of one. We were tasked with putting together dashboards, and I had a leader that wanted them done the way the whole system was, but he wanted them in 30 days or less. Okay. And I was new to, so you have IT people involved, you have data analysts, you have HR data, you have everything. So I knew that I call it like a train. Like you see the first car, but I know there's a bunch of cars behind. A lot of times owners of decisions, they just see the first car. They're just like,
Mm-hmm.
get her done. So I said, let me do some homework. I went back to the people the implementers and the evaluators that would be evaluating this and deciding, do I have people? And they came back and they said, Lisa, that thing that you're being tasked to do took us 60 days and 8 people to do a number of years ago. So in order to do that in 30 days, we would have to take off more people off the existing work, and they'd all have to stay focused on that. And here's the work that we're doing that we would not be able to do. So I went back to the senior leader and I said,
Mm-hmm.
okay, here's what I learned. And I said, so I just want to calibrate. So one of my favorite words is calibrate. So I want to calibrate and say, if that's what you want, I've got everybody ready to rock and roll, but then they won't be able to do these other 8 things for the next 30 days. And he freaked. He said, no, I want him to still keep doing the 8 things. So I said, okay, I have an idea. And he said, what? And I said, I did talk to him. I said, what if we did phase 1, which would get you these pieces, and we'll have the markers on the dashboard so that we know what we're working on. Phase 2, and I worked the rhythm. I went with those other individuals and
Right.
said, when would we be able to work on phase 2? They go 6 months from now, because then I have these human beings freed up. So it's phase 2. And by the end of the year, we'll have phase 3, which was what the leader had in his head. And it was systematized or systemic, so that we weren't having to do lots of manual work. And then it led to some other amazing dashboards. So I'm a fan of those resistors. A lot of times the resistors aren't resisting because they hate DE&I. They're resisting because they have other goals, and they can't see how your thing will fit into that thing that they
Mm-hmm.
were told to do. That leader, by the way, with the 8 things, when I left, he told me, he said, that was some of the most fun work I've ever done. And he said, I understand diversity better now, because we would have arguments about how are you counting people, right? I said, if one
Right.
person has multiple identities, I said, I don't want you counting them as 3 people, so how does the system do it? And he said, oh my gosh, now I understand. But we were also talking about, how do you manage confidentiality? How do you manage trust? How do you do all these things? So I use that methodology, and then I build in the assumption again that somebody else knows something more than I do, and they might be better at it than me. I have been on a learning curve, an extreme learning curve with analytics, and I would give myself probably a B now, but it's been a lot of years to do that. And there's no way I would even have gotten to that level of learning without these people who were SMEs and were phenomenal at it, taking their time to teach me. So I always liken the DEI is very much like that. Like, we're going into their space and they know everything and they're just like, come on, get it. And why don't you get it? And I'm sitting here going, I don't get it. Please, can you just start from first grade on analytics for me right now? And then now I get it, but it's taken me, 10 to 15 years to be able to talk about it. And now I can tell their story in some cases better than they do. And they come to me and they go, wait, I like the way you said that. And I said, it's because you're using too much of your jargon and nobody knows what the hell you just talked about.
Yeah.
So can we just figure it out? But I think it's that methodology. I think about I use more methodologies in high performing teamwork for DEI. And a lot of that methodology says bring in different voices earlier on, right?
Right.
Leverage subject matter expertise, figure out the end game. Like, what's the goal that's an inclusive goal that everybody can buy into? Reinforce it, right? Which is telling people, thank you. You did this. You got me to this part now. And the other part is now go. It's okay. You don't have to be on this
Yes.
group forever. Have a great life. But then when it comes time for recognition, is saying that person did this, right? That's the EVS. These were the voices I had. And so I think it goes to that appreciation too, which is everybody. I think about like great teams. People want to be in a great team. They want to be able to kind of be in that zone, but they also want to be recognized, and they don't always have to be they don't have to play all the time, but they want to know that whatever they did made a difference. And I always circle back and do the look at what happened. Thank you. And do you remember? And they're like, you remember that? And I'm like, yep, you did that 2 years ago. We finally did this. And it wouldn't have gotten to this place without that thing that you did. And so I spend a lot more of my time doing more of that circle back, which is high performing teamwork more than DEI work.
It is, but you're also the cheerleader in this. And something that impresses me and has always impressed me about watching your work actually is the way you put yourself into the learner position. So you model what that looks like, and therefore you make it safe for some of the leaders to actually follow suit. That's what I know.
Yeah.
And
thank you.
And in that process, you put your ego aside. And so there are actually three questions that are coming in.
Okay.
One that will take us into a totally different arena, but so I'll do the other two first, and I'll give you two questions that relate to this. One is about the frozen middle.
Yep.
That many D&I leaders obviously worry about, because that's where oftentimes change or cultural improvement measures or initiatives, that's where they get stuck, right? How does it, the question is really, does it work with the frozen middle as well? Or how does it, or do we need to do something differently? But before you answer that, what impresses me also about this is the how you strategize. Right? Because there is a lot of thoughtfulness and a lot of strategy development that you just described that does not usually get included when DE&I leaders talk about their strategy, right? Usually their strategy is around these buckets, right? The employee experience, the customer, supplier, those kind of things. But it's really, there is another strategy that you're developing. It's almost like the strategy, the engagement strategy. And I love that, actually. For anybody who's listening, who's dialed in right now or listens to it later, who's new to D&I, I think there is such learning here that you're sharing. And thank you for that.
Thank you. Well, full disclosure, I've always felt like the outsider on that, right? Because I think in a very circular and a holistic way. And a lot of times in organizations, it's very linear. It's very linear. So, it's got to be. So I'll give you an example with an engineer who I was working with at Cummins, and he's like, Lisa, I just don't understand this diversity thing. I don't know what to do. And I said, stop. I said, are you a good engineer? And he's like, yes. I go, how good? I like, you a great engineer or just kind of, he goes, I'm a really great engineer. And I said, here's what I know about engineering. And he said, what? I go, I know you have processes. I know that you look at the end game. I know that you've got processes. I know that you look at gaps. And he's like, yes. And his body language, started. And I go, that's what we're going to do. And he's like, what? And I'm like, so I think a big part of that. So my strategy is that, but it's not always very, my growth is really in being more transparent about it, how my brain works and how, like this, like being able to say, that's the methodology I'm using, not just doing it. Cause I was doing it, but people would be like, why is it working? And I'd be like, there it is. So the frozen middle, the way I do the diversity strategy, I'm always thinking the top down, I'm thinking bottom up, and I'm thinking about that middle. The middle, having been a middle manager, I've been a middle manager. So I think anybody that is doing this work, if you haven't been a middle manager, you got to go, you should do that as part of your, work at some point, right? Go take a line assignment somewhere. I've been a middle manager in the field. I've been a middle manager in corporate, and we were always complaining about both. We were always like, those field people don't want to follow what we're telling them to do. And then in corporate, you're like, then in the field, you're like, why don't they listen to us? They don't ever listen to us. So I think it goes back to love. It's what we started out with is I love the middle. I love the middle. I've, most of my family members have been the middle. Have been middle managers or technicians. They've been in the bottom. And you have to show that you care about them and understand and so when I go meet with the middle, I'll say something like this. I go, they'll be like, Lisa, the top doesn't understand. And I said, I know. I go, and it kind of sucks. I go, it's like the middle is like being a teenager. I said, you're not quite an adult, but you're not quite a kid. I said, in the middle, I said, there's people on the top telling you what to do, pushing down, and then you've got the people pushing up, and you're kind of stuck. So with them, I'll just say, again, how can I help? And many of them will tell you, okay, like that's where I understood in the healthcare that they were all freaking out about they had measures to have X number of patients in 20 minutes or less in order to get paid a certain way. And, these were the nurses, and then they were pushing it down to the people that were changing the beds. And they were, and so what was getting lost in some cases was that compassion.
Yeah.
So I sat there and I go, okay, given that, okay, what can we do in the 20 minutes? And I was at a pediatric hospital, and one of the things that was happening was they weren't even asking the name of the families, because they were just like, they were calling them mom. And I said, but names are really important in cultures. They're really important in cultures. Absolutely. And not just the names of the kids. So within the 2 minutes that we had to register a patient, I said, let's role model asking their name. And do you have a place in the document where we can write down their name? And she goes, yeah. So I said, let's just try it in the same 2 minutes. So we started asking, and then using that kind of connection, saying, I love your name. And then the mom, she goes, thank you for saying that. And then these are the names of my children, boom, boom, boom. And then we started asking, how can we help? And then we started going into it just in the same 2 minutes. So I think a big part of it and the strategy, the whole time I'm thinking customer experience strategy, I'm thinking connection, I'm thinking cultural differences, because names are critical. When I would meet a Nigerian family, I said, I know the word God is somewhere in your name. And they would start smiling. They're like, how do you know that? I said, well, when I went to Nigeria, I said, I would ask everybody, what does your name mean? And almost everybody said it had the word God in it. And I said, my name, Lisa, that it says consecrated by God. I go, maybe I'm Nigerian. Who knows? But you start finding that, and you start finding that connection. So by that shift, I did an 8-hour shift, or no, 6 hours. But by the end of that shift, which was at 3:00 in the morning, this young woman who was my boss, she said, and she was an hourly person, but she said, Lisa, that diversity training, I haven't done it. And she said, I just am so tired. And she said, what do you think? And I said, I think you go home, you get some sleep, and you just gave me some input. I've got to figure out how we can build in some time, paid time for you guys to take the training when you're awake and you're not tired. I said, but you go home right now and you get some sleep and don't worry about this training. And she ended up sending a note back and said, I just want you to know that here's what I've taken from that 2-minute thing. I've now built in asking names. So I think the middle, you have to walk in their shoes a little bit. You have to go in with like what, Dr. Sharon, I think, said about compassionate curiosity. You have to kind of go in and say that.
Yes.
You have to go in and say that, and you have to then be. So I focus on being.
Yeah.
being. So, I was a senior leader and I wore my tennis shoes and they said, okay, well, will you do whatever we want you to do? Yes. So they go to the fax machine. You got to get so I was walking back and forth with the fax machine. I was just doing what they needed. And then she came back and she said, oh my gosh, you added so much value, because it was what they needed.
Yeah.
If I'd gone in and said, I don't do faxes, it was what she needed to help with patient care. And that's really the boots on the ground that they needed. So I always think about the frozen middle. I think about them like, okay, they've got pushing up from both ends. How do I help relieve some of that pressure? The other thing they don't get told is they don't get told the why. They don't get told the whole story. They get told one chapter of it. They're like, you have to do this, but they're never told, here's this. So an example is, I had some EVS workers. And one of the reasons why, when you go into a hospital, these EVS workers are phenomenal. They have to do an amazing, great job with cleaning the rooms and doing everything so that it doesn't transfer infection, right?
Sure.
So you're sitting there, and I was talking to this one woman, and she goes, I've been here 23 years. This is what she said. She goes, I'm just a housekeeper. I go, just a housekeeper? She goes, yeah. And I said, let me tell you what I know about you, housekeeper. She goes, what? I said, if it wasn't for the way that you clean rooms, I said, you could actually increase hospital-acquired infections. I said, there's a reduction in hospital-acquired infections those scores have gone down. I said, because of you guys. And she looked at me, she goes, that's right. That's right.
Again,
And
it's the pride. Yeah, right? You're
got to
connecting
connect, but
people.
the middle, you've got to connect to what
Yeah.
people are there for. And so I think if you don't spend time with the middle, there's no way to do a great diversity strategy without the middle. You just can't.
So, I so resonate with that's the anthropologist in me, because what you did was being an anthropologist, right? You said, let
I
me
love
figure
that.
out what this work is that people are doing, who I am going to ask to change something. But
Yeah.
can I actually ask that of them unless I understand what their life is like and why they're doing what they're doing, and who they are, in a sense, right?
Right.
And this reminds me, this is a different way of implementing reverse mentoring.
Yes.
Right? But the difference is that in reverse mentoring, we are taking somebody's, characteristics, let's say, and putting them into discussion groups with senior leaders. What you're doing is, you as a senior leader, you're going to them and you're spending time with them, and you're actually engaging in the things that they are engaged in every day, and you get to know them by virtue of that, of course, and their background and so forth. But I love this as a recipe for reverse mentoring, actually.
It actually works. And I think that's the other part. So everything that you're doing around inclusive leadership is really about us as leaders shifting.
Right.
We have to shift. And it's so powerful, right? And that's a big, when you go to college and everything, they're telling you how to do, but they're not always saying, and by the way, by the time you figure that out, you're going to have to shift in, 6 months or ago. And they don't tell you that part. They just say, here's what you do. And it takes, so this is when I look at younger practitioners now, I tell them, I go, man, you can learn from us faster, right? You can learn and say, I'm going to start doing that shift now, versus making all the same mistakes, I made, right? Of assuming, but when I have to tell you this before we go, when you said about the gap, one of the things I saved when I went to the UK was, you remember when you get on the metro, it says, mind the gap, right?
Right.
mind the gap. And I think that should be our tagline too in DEI. Mind the gap.
The gap. Right? Absolutely. So now I'm going to take I presume we filled an hour already. Do you have a little more time, or do you need to go?
Yes, I got time.
Okay, great.
For you?
Because then I'm going to take this conversation into a totally different turn. And that's more, we know that in the United States right now, DE&I has taken a beating, right?
Mm-hmm.
It's already been challenging in organizations. It's already been contested for all kinds of reasons. But now we're getting into a social climate, a political climate, where in certain states, DE&I cannot be is under assault, much more so than
Yeah.
others. But I mean, and again, we're taking this global tour, but I'm just really curious, and this came through in a question here also, how the current state of DE&I, this embattled state, how you are reading this, first of all, as a professional, and what that means for the practice of DE&I in the U.S. and maybe abroad too, because I see similar tendencies in other markets as well.
It's interesting, just watching it, and particularly after the Supreme Court decision here in the United States. It was fascinating, right? All of a sudden,
Yeah.
there were opportunities that I was in that suddenly froze, and people said, we want to rethink it. What I'm noticing is I feel like we're taking some steps backward.
Hmm.
I feel like we're taking some steps backward culturally, but it's reminding me too that when I first started doing a lot of this work, I always thought of DEI as a competitive advantage.
Hmm.
And then you came into I always think about this. If I love Michael Jordan, so I was in Chicago. So I thought if everybody's a Michael Jordan, then who's the Michael Jordan?
Hmm.
Right? So okay, then who's the Michael Jordan? So what started happening, I think, in organizations was everybody was putting in DEI work and putting in CDIOs without really spending the time to focus on what's the it, how do we really connect it to what our organization is about and what we want. So it became very popular. So what I'm seeing now is that people are recalibrating and saying, I don't know if I really want it anymore, but the political climate is saying you don't have to do it anymore. You don't have to show
Right.
it, right?
Right.
So I think what's going to happen is that it's going to go back to that time where the people that are doing it and continuing to do it in the right way, in a very holistic and inclusive way, are going to create a competitive advantage.
Hmm.
Because human beings, particularly Gen Z and others, and the world is diversifying, right, in terms of talent, right? When you look in healthcare systems, the people that they're recruiting that they need are nurses and medical assistants and others, and many of those are people of color.
Yeah.
And they're from other countries. They speak other languages, and they have a heart-based connection to healthcare. But they're also saying you have to respect me. So you're going to come to that same point that we've always been, which is people are going to say, "Can I get my business done?" If I'm in the healthcare, if I'm in marketing, if I'm selling stuff, can I get my business done by not being open, and adapting to people from different backgrounds? So I think we're gonna swing back to the who's creating and maintaining a competitive advantage. And then we're gonna have what we had in the past, which is then it's gonna be like that, that race again, where you're gonna start seeing people fall back, and then you're going to start seeing change in leaders or whatever. But then they're going to start saying, I need to figure this out again. What they're going to find, and this is the part that I think is going to be challenging, is it's kind of like going to the gym. If you stop going to the gym or stop walking, right, and you suddenly say, I'm not going to walk, I'm not going to walk till I have to. You're going to have a tougher time walking, right? So I
Right.
think the people that don't stay in the mix on DE&I, then they're going to, right now, the social media and the political climate is such that people now, in one comment, they can say, that person is awful, right? We've seen CEOs gone in a hot minute, but they have good packages, I'm sure, but they're gone in a hot minute because somebody now said, you sexually harassed me 10 years ago. Done. You're done, right? So I think that what I'm seeing is that we're going backwards a little bit, but I think the really good organizations are going to still keep moving forward, and they're going to do that. I think in the political climate, there are a lot of people, and this goes back to experience. I worked in California at the time of Prop 209, where it made affirmative action illegal. So I figured out, how do I do it? So one of my standards was, I chose the highest standard. So if the highest standard was a federal standard, I went with that. If the highest standard was a global standard, I went with that. If the highest standard was a California standard, I went with that. And all of a sudden, so if the highest standard is, if it's the best, right? And that's why I'm saying in other cultures, they might have a better thing. And if that's the best, and you want to create a competitive advantage, doing that always keeps you above the political muck, I
Hmm.
think.
Yeah.
So when President Trump made some of the, anybody that was receiving government funding, when he had an executive order that made a lot of diversity stuff illegal, right? So we had people look at all my stuff and they're like, you can continue. You're like, that's because it was inclusive and it wasn't designed to be inside or outsider, right? It wasn't designed to be either or.
Inclusionary, yeah.
And so all of a sudden people are like, it is inclusive. So I had, lawyers saying you could do it. I had, majority population saying keep going. I had minority population say keep going. So I think we're going to have to, I think the political climate, I think there are going to be people that freeze because they don't know how to maneuver in it. I think you're going to have to constantly think about what's the end game in terms of if you have panels, for example. I had one organization that had a panel and they only wanted to showcase one political party. And I told them, I go, oh, and sure enough, they had so much negative reverberation from it. And they go, what would you have done? I said, I'd have done a panel to say, here's what the political climate is, but I would have had strong viewpoints from all of them. I wouldn't have wanted to do that, but the CEO wanted to do it. But I said, but I would have done it in a balanced and an equitable way. It would have been facilitated tightly. Everybody would have known what question there would have been. But the assumption would have been, we're all working here. We all work here and we all signed on to these values. So the values would be prominent to be the facilitated parameters, right? But then they were surprised. They were surprised that everybody was mad. And then they had a lot of employees that came out of the woodwork saying, well, that's what you believe. And that's not what I believe. I'm out of here, right? And then they had turnover and then they were like, what? And I go, oh my gosh, you guys have to think. So I think the political context is going to require people to play out their idea further out before they do it.
Yeah. Do you think this is an interesting question that somebody is raising here? Is political diversity a dimension of diversity that we almost need to claim or pay attention to as part of this work?
Yeah, I think the dimensions I use, I think you got to look at differences. And the question I always ask is what dimension is impacting your work and your life? And then I think you've got to be transparent about it, right? In some organizations, let me give you an example. If you talk about the political identity, your employees might have a political identity, but your organization might have to orient to certain political identity in order to get funding. So I had one organization and one of the educational things that we did was to educate people on how money worked, how the money came in, and what would happen if this party won.
Yeah.
What would happen with this one? And then how many jobs would go in or go out? And all of a sudden you had people going, oh, wow, if this organization goes that way, then I lose my job. If that organization goes that way, then my friend loses their job, because that piece of work will go away. So the common element was educating people on here's why an organization might have to stay in the middle, might have to balance out both because they're looking at these, and this is why from the outside you might think they've turned on us. They don't understand, and from the inside somebody's going, oh my gosh, I'm trying not to lose, millions of dollars, which would equate to X number of people's jobs. I found that the middle and the people lower at the bottom, because the leaders weren't telling it. They're like, they were trying to protect employees. And the thing that I love, my dad was a technician, but they understand it. They can feel it. Like in one organization I was at, and it was the economic downturn, and I had a senior leader was getting ready to, so the CEO told him to come talk to me. He goes, go talk to Lisa. And he had to do he was planning on a RIF, a reduction in force. And it was going to affect, but we knew that when the business came back, you were going to be recruiting from the same marketplace, right? So I was thinking, okay, we've got to do it in a really great way. So the question I asked him is, I said, what kind of RIF do you want? And he's like, what do you mean? I go, do we want a good one? And he goes, what? And I said, so what would a great reduction in force look like, right? And he's like, I never thought about that. So he went back, we put the plan together, but we used a lot more change leadership. We started thinking about people. So one of the things that was unionized, we went to the union. I go, we've got to build the union in. We've got to build them in earlier rather than later. Are there a couple people that you trust? And he said, yes. So we built them in and we said, here's the situation. And the situation was such that there wasn't enough work coming in and they could feel it. And I said, I said, ask them what they understand to be the what's going on. And they, you know what they said? They go, there's not enough work. We have more people than work. Something's going to happen, right? And the VP called me and goes, Lisa, they know. And I go, exactly. I said,
They
and in fact,
know.
they knew before you did, because they knew that they weren't getting overtime. They knew that there wasn't enough work, and they knew they were bored, right? There wasn't enough work. And I said, now, if you honor human beings, so we went back to them and we said, okay, what do you think might be the decision? And they go, we're asking two things. One is that you don't shut the plant for forever. But secondly, we do think there needs to be a reduction in force. And then they said this, they go, and we thought about how to do that. Oh my God, it was like awesome. And we ended up with the goodbye stuff that we ended up, I used the William Bridges changes and transitions. So I did the endings, and in the endings, we let them honor the people that were leaving. And it was one of the best things I've ever seen. And they came back with little things like, Lisa, the policy says that we did something wrong. So they escort us out with security. And the VP came back and he goes, I said, well, what does, I didn't use this language then, but now I think about it, what does love look like? So I said, what do you think we should do? I go, what do they want? He goes, they want to go out with pride. So they branded the boxes, they branded everything. And they, now there were some people that were mad, right? So we still honored them, but we didn't make them fake it, right? It wasn't like you were faking it, but this is the part that I think about, to your point about DEI or where we are in this political context, is workers know. They already know, they feel something, and they're more afraid of you not calling it or saying whatever the it is, because then they start going, well, then it must be this, it must be this, it must be this. And so I'm a fan of telling people the truth as early as you can, as much truth as you know, and trusting them with helping you with the solutions. And that's not always popular, just so you know.
Not always popular. That's right. Well, but what strikes me here is that your recipe, I mean, I just keep coming back to this, is relatively simple. Honor, but it's hard at the same time. Honor human dignity, right?
Yep.
And nurture their pride. Understand and nurture their pride. Ooh. And I think and then of course I'm thinking, to our discussion around language, none of this language, and give them love. I mean, if you add to that, right? None of that language is classic DE&I language or jargon, right?
None.
And I'm wondering, is the future of DE&I such that we need to take? I mean, the language of DE&I exists for good reasons. It's accurate, right? It comes from research. It's a technical language to some degree. But can we, or should we do DE&I without the language of DE&I, right? I mean, and that is what your experience somehow teaches me in this case, that there is the technical language, we need to put that to the side, because this is about human beings in organizations and how we work together and come together. And we need to model this attitude, this central attitude, which I would call the attitude of inclusive leadership in this case, honoring human dignity.
So I've traveled to lots of countries, 31 countries, and I've done work in lots, but things are relatively simple, right? And it's like what you said. I always tell people this, like, let me ask you this question. Can you feel when people respect you? Yes or no?
Of course.
Right. Can you feel when they disrespect you?
Of course.
Yeah. Can you feel when they give you energy?
Of course.
Can you feel when they suck your energy?
Most definitely.
Right? Now prove it.
Yeah.
You can't prove any of that, but you know it, right? And around the world, I've met people that are trying to do the right thing for their families, right? Even if it's not what I think is the right thing, but they're trying to make their lives better for their families. They have beliefs that they might be equally strong than you are. So I think you're right. And I think it comes back down to humanity. And I think this is the part as a practitioner. Every practice, to be better at it, you have to be willing to go with the new stuff. Like I think about, the 4-minute mile in the Olympics, right? You could win an Olympic gold with a 4-minute mile. You can't do that anymore.
You can't.
So anybody that wants to go win an Olympic gold with a 4-minute mile, you already know that's a failure. So your decision is, do you still want the Olympic golds? If you don't want it, that's okay. Good, you won. But if you do want it, you're going to have to shift. And there's new technology, right? Now they're saying, like with football, concussions, right? Now they're changing the rules for you can't hit a certain way. Dick Butkus, I think, recently died. He's an American football player, but he was considered one of the most ferocious. And I think about it now, my brain thinks, oh man, how many concussions did he get? But everybody was like, his pride was, I hit the hardest. Well, it's changed, right? What you were allowed to hit, how you were allowed to hit then versus how you're allowed to hit now is different. So I think as practitioners, that's why I go back to that rhythm and that anthropology that you talk about is cultures adapt, right? Cultures adapt. There are very few pure cultures, that don't have some sort of input. I was in India, and most of the places that I was in were very poor and everything, but almost everybody had a cell phone. So we had to think about, but they didn't have a bank. So we had to think about, how do you pay people? So when you think about apps like Venmo and these kinds of things, it makes sense, that now the world is adapted to the way people live and breathe. And I think DE&I has to be the same way. And I'm with you. I come back to what I said earlier, is that I think great leadership, great leaders are doing some things. And I don't believe that they're always born, but I do think that there are people, some of the being stuff that they're doing is they are kind. They are open.
Yeah.
They are curious. They are learners. They are humble. Like, they're not, like, some of the best CEOs I've ever worked with would call me and go, Lisa, I don't understand this, but can you come spend some time with me and teach me? Those were CEOs.
Yeah.
And I've also worked with other CEOs that say, no, I know everything about it. And I'd be like, you've been to 1 2-hour diversity class.
And now you know everything.
Maybe you shouldn't use that word,
Right.
And you're sitting there and everybody else is afraid because they're saying, well, you can't give that feedback. And you're sitting there going, oh. So what I've had to develop is the skills of how do you give feedback,
Right.
Not go do another diversity training. I was like, how do I give feedback?
Yeah.
How do I think about not just George Floyd, but also Drayson Reed, because everybody kept talking about George Floyd, but we'd had a death of Drayson Reed on May 5th. And so I had local people saying, well, are you just forgetting about Drayson? So I built Drayson Reed into that to honor him. And so you start sitting there going, but if you don't adapt, so I think it's what you're talking about inclusive leadership. I think a lot of it is that flexibility and adaptability, but also the guidance to get to a direction. So I always tell people with diversity, I said, a lot of times I'm just getting people to get on the same freeway, going in the same direction, but they don't always have to be in the same lanes.
Correct.
But you want them going in the same direction. So if you're in Europe and I need you to get to France, it might be easier for you. But if you're in California and you got to get to France, it's going to be a little bit longer. But at the end of the day, we all need to be in France to do this chunk of work together. Or do we all need to be in Africa to do this chunk of work together? But I think you have
Our
to
paths are different.
Allow that.
Yeah.
Yeah,
allow
that.
Again, I so resonate with everything that you're saying. I know we are almost out of time, but I want to give air to this one question that's coming in, and I'm adding a little bit to it as I usually do. But what's on the horizon for DE&I? And the question is really, with all these human qualities that you're describing, what is the role of AI? And the intersection with the work of DE&I?
Oh my God, that's such a good one. I was thinking about this a lot, and I've been thinking about this AI thing. It's interesting. I attended a couple webinars on AI recently, and a lot of it comes down to the humanity of, like, how do you build humanity in? And one of the things that keeps popping up is diversifying the viewpoints in the design of AI. So what worries me the most is people designing in a new technology or a new way of doing things without thinking about differences and how it might play out. So I don't know if you remember years ago, I think it was about 2010, I think it was Microsoft or a big company had come out with a new technology. It was the precursor to FaceTime, somewhere around there. but I don't know
Yeah,
if you remember
yeah,
that
yeah,
it didn't acknowledge different skin colors.
yeah, yes, exactly.
And
Yeah,
we were in a meeting and everybody was, saying they must be racist. And I go, I think they probably just didn't have a diverse team, right? They probably, because IT people like to play with their toys, they like to test them and they like to take them home. And so I thought, and sure enough, the team that they had gone pretty much to the same university. They were in the same place. They hadn't really built in that diversification of thought, impact, outputs. So I think AI can be really, like, when I think about data, uh, you know, we spend so much time in DNI trying to count heads,
hmm,
count the right heads
yes,
demographically, measure them versus census or whatever. I've always had to build that in almost every place I've been, and do it in a holistic way. That it would be awesome if some of those AI or technology built that in at the beginning, so then I can tweak, right? Like, it'd be neat if they're counting 3 genders. I've had to put that in 2 places. So it'd be neat, like, just start
right,
counting the stuff at the right way, in a holistic and in a broad way, right? Languages, like, language impacts healthcare. It impacts everything. It impacts your ability to not go back
sure.
into a healthcare situation. And yet, trying to track, how to get the right language. So I think AI can be really helpful if it helps with some of that baseline data, but only if you really acknowledge and don't build in, um, biases into the system. So then you end up generating data that encourages biases, and that stuff ends up, like, I always think about our work. I'd love it if all the people that then come in to organizations don't need diversity training.
Yeah, I mean,
Right.
it's certainly not about diversity training. We know that.
Right.
It's-
But if they've all learned a lot of that and they're already holistic and they're thinking and that kind of stuff, then you can go to another level on how to work
that's right.
together. But in AI, I think it could generate some of that, because from what I understand with AI, it's supposed to help with routinization of things
Yeah.
and helping that kind of thing. But it won't help if it's designing stuff that doesn't recognize certain elements of dimensions of diversity and things, like you're saying. Like, if I have a bias in one company where everybody's being hired from the same political party, that's a bias,
Right.
right? So
And that
then
then
that might
becomes the
actually drive
criterion for
leadership.
success, right? And so we get
Right.
reinforcements. And I wonder sometimes, I've seen teams create biased products and fail, right, as a result.
Right.
But in doing some of the analysis, where did why, right? It wasn't always a lack of diversity on the team. It was actually a badly designed work process that goes back to
Yep.
some of your comments earlier, and sometimes just the sheer stress levels that didn't allow people to activate that part of their brain space that they needed to be in, that reflective space to
Exactly.
actually notice, oh my God, we can't do this. We need to stop this and do something else. They would have had the ability based on the diversity and the experiences on the team. But if the job is too stressful and we're trying to meet an aggressive deadline and we're all just essentially in this myopic mind state, then all the diversity is not utilized. So it takes an inclusive work design, workplace design, work process design as well, in order to make that happen. I'm just resonating with what
No,
you're saying.
it's
So
it's true. And then it also I think about a fishbone, right? But you also think about all the other pieces, right? And sometimes people, they want to get things, like you said, get things over the goal line. Let's get the product, but then they don't think about, well, you just created a lawsuit on this side of the house. And now we're spending as many millions of dollars on the lawsuit as we were bringing in money on the product. And so that's what I like to do sometimes. That's where, to your point, looking at a process, but building in the process that says, let's look at failure modes, potential failure modes, right? And I love that language of failure modes, of being able to say, what could be,
right.
and then all of a sudden you have people that are afraid to say, then they would say, oh, failure mode could be this. And a failure mode could be, and then all of a sudden you're like, oh, is that happening? But to your point, you need thinking time. You can't just rush things. And you have some cultures that want to rush things. And then they're like, well, we don't care about the lawsuit.
Right.
So I think,
Well,
yeah,
and
I
also
don't know.
as things become more competitive, right? Companies, rightfully so to some degree, and especially I think in AI, the development is faster than we can build the cultures to inoculate the organizations and culture that are
Yes,
driving this development, right? So that's the stuff I worry about sometimes. Do we have time?
you're right on. And typical, like I saw something recently, like even the laws in countries, right, are following, and sometimes years later, what the technology is allowing people to do. And so you have people sitting there going, okay, now we've got that law, but then AI, like, how would you do it? So
Right.
I think we're adopting things so fast. So you're talking to that's about as much as you're going to get from me on AI. So,
Well, and we are
taking it.
also out of time. So,
Okay, good,
so I
perfect.
want to, first of all, I want to thank you for this conversation, and sharing, a lot of the secrets that have made you successful. And they're not, I know this because as you know, I do a lot of work in this space with organizations. I know that your work is exemplary. It is unique. And my deepest wish is really that many organizations and DE&I leaders learn from your experience as well, because I think just putting these principles into action, and allow me to say also embodying them, which I think is your strength, right? You're not just talking about them. You practice them. You build your success and your practice based on embodying it and being it and demonstrating it to people in a very immediate way, where you don't need to lecture, you don't need slides, you don't need to to do what you do. And I think this is so phenomenal and very unique about what you do. So thank you for sharing it today. Thank you for everybody thank you everybody who sent in those wonderful questions, and who's engaging with this in our curiosity. We'll continue this dialogue with you and others in this space of DE&I. But thank you for joining us today.
Thank you, Joerg. I feel always spending time with you. I feel energized. Thank you, everybody.